Hello, my name's Dr. Megan Boyk. I'm a family medicine resident physician at the E. Blair Warner Clinic and Memorial Hospital here in South Bend. Biggest fear about COVID-19 as a healthcare provider is that our healthcare system would become overwhelmed and we won't be able to take care of the people who need it. If we compare this new coronavirus to the seasonal flu, this virus is more likely to be spread to others, more likely to put you in the hospital, more likely to make you sick enough to need care in the ICU, and more likely to die from it. As of my last check this morning, which is April 23rd, we've had over 46,000 deaths in the U.S. from COVID-19 already. To compare to the 2018-2019 flu season, we had about 34,000 deaths. So already this is worse than the flu. And if you look at what's happening in places like New York City, Detroit, that have been especially hit hard by COVID, and even in Chicago, which is very close to us, what I'm hearing from my friends who are doctors and nurses there is that they don't have enough staff to care for these patients. They're running out of ICU beds and ventilators. They're running out of the equipment that healthcare workers need to protect themselves and their patients from infection. So that's forcing healthcare workers to make really difficult decisions about who can get the care that they need. Fortunately, at least where I work here in South Bend, we're not at that point yet, and hopefully we won't ever be. But if our numbers continue to increase in our community, we could get there. And that's what I'm most afraid of, that I will have a sick patient in front of me and not have what I need to help them get better. And we can prevent that from happening by flattening the curve, by distancing ourselves from others, by washing our hands often, preventing infection. We can slow down the spread in the community to a point that our hospitals can handle the amount of sick patients who need care. So that's why it's really important, even as state and local governments begin to relax the restrictions in place, to continue to be careful, to be safe, and to do everything you can to prevent yourself and others from getting sick. So the most common symptoms that we see in COVID are fever, cough, and fatigue. A fever is a temperature higher than 100.4 degrees Fahrenheit or 38 degrees Celsius. You can use a thermometer under your tongue with your mouth closed, or for younger children, you can put the thermometer under their arm, although this isn't quite as accurate. Before you check your temperature, you should clean the tip of the thermometer with soap and water. And for 5 minutes, keep your mouth closed and don't eat or drink anything. The cough that you get from COVID is usually dry, but it can also be productive, which means you're bringing up phlegm when you cough. Some less common symptoms of COVID would be things like poor appetite, muscle aches, difficulty breathing. We're also hearing about decreased smell and taste, headache, vomiting, diarrhea, stomach aches. And of course, these symptoms are all really common in other less serious conditions as well. And you can't tell the difference between COVID and another infection like the flu or the cold without testing. So if you're not sure, you should always talk with a doctor about your symptoms, and they can help you to decide what's going on and what the best next steps are. The best way to prevent yourself from getting or spreading COVID is to avoid being exposed. These are really common sense precautions. Stay at least 6 feet away from other people. Wash your hands with soap and water for at least 20 seconds. Avoid touching your face. Frequently clean and disinfect surfaces that you touch every day, like your phone, countertops, doorknobs, sink faucets. And to protect others, you should cover your coughs and sneezes with your elbow or with a tissue and wash your hands afterward. Wearing a cloth face mask can also reduce your risk of spreading COVID to other people, but you should still follow social distancing rules if you're wearing one. There are a lot of rumors going around about different tricks and medicines and vitamins to prevent COVID. We don't really have any research to say whether those things are effective yet, so I think the best thing to do is to just follow the common sense precautions that I mentioned, keeping your distance, washing your hands, covering your coughs, and keeping your living space and work. We're just Muchas gracias por escucharme y vamos a luchar juntos en contra del COVID-19.